So, before diving deeper into the unequal planes research itself, I think it's really important to frame the purpose of research at Women's Fund in general. We have lots of different experiences with research in our different walks of life. So, in short, Women's Fund does research that has relevance to our mission and our focus areas, and it's in alignment with our organizational values. And what that means is that our research might actually look a little bit different from what may typically come to mind when you think about research, like academic research in a journal publication, for example. We're not as focused on discovering, highly technical insights to advance general knowledge. Instead, our research is more focused on accessibility and actionability. It especially focuses on our local landscape in Omaha or in Greater Nebraska. So I think, again, that's important to keep in mind when we talk about what this unequal planes research is about. A quick reminder that Women's Fund has four main focus areas for our work. Those include economic security, sexual health literacy, freedom from violence, and women in leadership. So for unequal planes, we decided to focus on economic security especially. And when I say it's original research, we collected and analyzed data from primary sources. So the purpose of this particular Unequal Planes project is to explore economic security of Nebraskans who experience gender-based oppression and that systemic nature of issues surrounding economic security. For example, we were fully expecting to find that there is a gender wage gap in Nebraska. Spoiler alert, there is one. Years of economic research have established that trend. We know it exists. However, in alignment with this overarching purpose of research, we really want to understand what the gender wage gap actually looks like specific to Nebraska. And we really want to include data and stories so we can all unpack a little bit more what something like the wage gap actually means. And so all of us can sort of digest and understand that. We also wanted to emphasize that obtaining economic security, isn't just about that individualistic pull yourself up by your bootstraps mentality. These are systemic issues, right? Women's Fund is looking at systems change. So we're especially interested in how economic security is a systemic issue and how it might intersect with other things like caregiving and housing. And you'll see that reflected in the findings we share today. And ultimately, all of that ties into like, why are we even doing this research in the first place? And again, it really ties to our mission at the Women's Fund about action. So we want to galvanize more Nebraskans to advocate for change, really finding ways that we can support each other, neighbors, community members, taking action in whatever space, makes the most sense for folks and the types of influence they have. So for all of the methodological folks out there, I wouldn't be doing my research job if I didn't tell you about our methodological approach. I will keep it very brief. For anyone who wants the really in-depth stuff, we have a fully detailed appendix in our report that is dedicated to that, so I encourage you to flip there. That said, again, I think a high-level understanding of our methodology really helps all of us make sense of the findings, and especially what we're going to share today. So overall, Unequal Planes research used a mixed methods design. So that means we used both quantitative and qualitative data. So on the quantitative side, the primary source was 5-year American Community Survey data. That's data from the US Census Bureau. It's a large-scale representative survey. Lots of folks use it for economic research. It's very common. And we worked with research partners at the UNO Center for Public Affairs Research to analyze that data for this project. Shout out to them if you haven't done work with them before. They are a census expert in our state. So highly encourage you to contact them for any of your census data needs. However, we did that part of the research first. And what we found, especially thanks to some of the work of our research advisory board that we engaged with this project, is that census data, like any data source, has lots of advantages, but it also has limitations. So, for example, with Women's Fund and our work in particular, the way we frame our work and our values is that we include women, girls, and anyone who experiences gender-based oppression in our work. So many current research institutions, including the Census Bureau, They just collect gender data in the binary. I think they do specifically male and female self-reported data. So as we know, that's not gonna give us as good of an understanding of experiences of gender expansive individuals. Um, so it's those types of limitations, among others, where we really realized we need to add a qualitative strand to our research. So, in addition to helping us understand experiences of those who might be marginalized when looking at broader quantitative data sets, again, folks like gender expansive individuals, the qualitative data also adds depth. It doesn't tell us just what the trends are, but it starts to illuminate how and why those trends might exist. So, on our qualitative side, I want to give credit to our independent researchers, Alyssa Sutton and Tracy Redding, as well as a host of community-based organizations that we worked with across the state to host interviews and focus groups with women and gender expansive people, really to learn more about their lived experiences with economic security. So again, think back even to the way that y'all responded in terms of what being financially secure means to you in the chat. Lots of different responses and perspectives. And that qualitative data collection that we did and the analysis is really intended to get a better sense of that, really that depth and that nuance. So ultimately, combined as what we ended up with our unequal plains research. So it's a combination of Nebraska-specific quantitative data, and then we ended up with quotes and stories from more than 80 Nebraskans. So I think that's a really amazing thing. It's specific data to Nebraska. And everything that we share today, those quotes come directly from the people that we spoke with. All of the data come directly from those data sources. So, without further ado, with all of that context, I'll dive into the findings themselves, where we'll spend most of our time today. So, we grouped findings from our research into six main categories or key findings. Those are all listed on this slide. And what we're going to do is we're just going to go through and share a little bit of each of these categories with you today, one at a time. So to start is the finding around the wage gap, where we found that the gender wage gap in Nebraska is persisting. But before I share all of the findings, this is one of our engagement opportunities. So we're going to start a poll and see what you all think. Just your best guess. What do you think the wage gap is between men and women in Nebraska? And again, that's if you're thinking about full-time workers and what they earn over a full year, that median annual earnings. We're going to give people a couple minutes. I see lots of responses floating in. A little longer. All right, let's see what everybody thought. It looks like it's a pretty even split between A, B, and D. It's about a third across all of them. So this is a fun answer. The answer is everyone is actually right for this one. So everyone gets a gold star. You might be wondering, how can that be? And the answer is basically, if you further disaggregate the gender wage gap by race and ethnicity, the gender wage gap varies considerably. And that's really important to keep in mind when you're thinking about the gender wage gap. So the graphic on the slide here depicts all of those differences. So for those of you who answered A, the wage gap being sort of around that $20,000 range, you highlighted the gap between white men and Latino women, or the largest gap. For those who answered B, around $10,000 or $11,000, you highlighted the gap between white men and white women. We didn't have any answers for C, which was that negative dollar amount. But I think an important piece to see and notice with this data here are that white women actually make more than Black men, Native American men, and Latino men. So the specific answer for the option we gave, that negative $2,000 to $3,000, is the difference between what Black men make and what white women make. And then finally, D, or that $16,000, $17,000 range, it does represent that overall gender wage gap between men and women without disaggregating the data by race ethnicity. So ultimately, while the wage gap impacts all women to some extent, it especially impacts women who are Black, Indigenous, and Latina. And again, that's established with a lot of the other general economic research as well. And it's true in Nebraska. So the analysis on this slide, we're going to get a little bit nerdy for just a minute. This is the unadjusted wage gap. So it doesn't account for other work or social factors like occupation, hours worked, age, education level, stuff like that. So those of us who might be talking about the wage gap with some of our fellow humans who have some questions for us about it, a lot of the times you might hear responses like, well, women are employed in occupations that don't pay as much, and that's why the wage gap exists. And that's partially true, and there's a lot to unpack in that statement. The full report for Unequal Plains has more detail, because occupational segregation, how of experience, they do contribute to the wage gap, but they do not fully explain it. And the question about that is how do we know that? So our analysis indicated also included what we know as the adjusted wage gap, and that's where we take more sophisticated quantitative analysis, um, basically using multivariate regression. So that essentially controls for the influence of other factors within the analysis. And, given everything that's available in the ACS data set, we're able to control for all of the factors listed on this slide here. And then still, even when accounting for all of those factors, the gender wage gap in Nebraska is around $13,000 to $14,000 in median annual earnings. So again, all of those factors controlled for, the gender wage gap still exists. So that means that something else is going on. And that's where some of our qualitative findings shed additional insight. Ultimately, gender-based discrimination and bias continue to shape pay and employment experiences. And again, that's also supported by general economic research. And I just want to share again, some of our research participants really shared their experiences with that. So, for example, there was one participant who said they earn less than their male coworkers, even though they do the same physical labor. Um, and then another participant even highlighting really overt forms of discrimination, right? They were told that the law says that men get paid more. Again, more in the report that highlights the gender wage gap. I'm going to move us along to caregiving. So our next finding is that expectations on women as caregivers impacts their well-being. And you'll see that a lot of these findings intersect. So we did find that caregiving is intertwined with women's workforce experiences in Nebraska. So further contributing to those gender disparities in earnings, our data supported what economic research has termed, it's called the motherhood penalty. So basically, after giving birth, women's pay falls behind pay of similarly educated and experienced men with children, which is what you see on this line graph on the screen, right? There's sort of this divergence as folks have more children, which is shown on the axis along the bottom. What's interesting as well in Nebraska in particular, Nebraska women are likely to stay in the workforce after having children. So, of women in Nebraska who had a baby in the last year, 71% are employed. We also have the third highest employment participation rate among women. If you look at all states, we're a third of all of the states. So adding that systems lens, our findings really indicated that insufficient systemic supports contribute to women making unsustainable trade-offs between unpaid caregiving and paid work. Again, I think these are things many of us, experience in our own lives. So stories from participants unpacked several different dimensions of those systemic influences. Like general norms around women being expected to be primary caregivers, lack of workplace flexibility, things like caregiving obligations or the cost of childcare. So lots of quotes spoke to that. There's many in the research report. But I think one that really hits it home is this participant who shared that when she got her first paycheck, that she had the paycheck to pay the babysitter and she cried. So moving us to our next finding, really focusing on aspects of housing. So that does bring us to our next poll. So I'm curious what you all think. True or false? Women in Nebraska have higher rental costs than men. Giving you all a little time. All right, those are some fast responses. Everyone is pretty confident. Let's go ahead and close that one out. Y'all are a very smart bunch. True. Women, in fact, do have higher rental costs than men. That's the answer. Good job, everybody. Um, so I think this is a really interesting finding if you think about how it intersects with that caregiving piece that we had just talked about. Um, so basically, our research found that Nebraska women who are renters have an average rental cost that is approximately 19% higher than men's. And this difference is likely due to more women living with children in their home, and therefore they require larger and more expensive housing units. So again, you see sort of that interplay, right, between economic security, housing, and caregiving all sort of tying together. So our qualitative data elaborated further on those intersectional experiences with housing. Many highlighted how difficult it is to secure housing that can accommodate families. And then adding on even different layers of identity and experience on top of that can compound challenges further. So, for example, a couple folks, they mentioned that landlords are hesitant to rent to families with many children or immigrants. There's even this other participant who mentioned, housing stock availability for large houses are hard to find, and then even hinting at some sources of income source discrimination, for example, different types of assistance you might be using to pay for housing, not being accepted. So moving us right along, again, we're going fast, but please do reference the full report for lots of more detail. Um, Our next finding revolves around access to affordable healthcare. So, getting access to and paying for healthcare, interestingly, was a topic that emerged organically, especially as we were talking to our research participants and focus groups and interviews. It came up basically as they were discussing various indicators that they didn't feel financially secure. So I think what's interesting to think about there is that the majority of women in Nebraska do have health insurance, and they're insured at rates comparable to men. Both groups are insured at rates a little over 90%. Um, Another thing to keep in mind, sort of those who are insured, about 1 in 3 women in Nebraska have publicly provided health insurance, such as Medicaid or Medicare. But right, like I think this is where the disconnect comes, and what our qualitative data really illuminated is that while having health insurance, is great, it's important, it doesn't necessarily translate to affordable or adequate care. Um, and furthermore, public insurance like Medicaid or Medicare, it provides that critical support, but eligibility rules, limited coverage, it can make it a little bit precarious. And that's something that our participants did speak directly to. For example, some participants pointed out how Medicaid often doesn't cover dental care. So I thought this particular quote was especially enlightening and descriptive, right? This is someone who's talking about just trying to find a dentist who would accept Medicaid for her daughter who had a really urgent dental issue. And finally, right, couldn't find one and ultimately had to pay out of pocket for a pretty intensive dental need. So again, sort of related to that publicly provided healthcare idea is our finding that public assistance overall, um, there were more themes there. So public assistance overall, would include things like SNAP, Social Security, TAMF, ADC, all of those things. So many participants just spoke to the precariousness of their financial situations in lots of different ways, um, and really described the critical role of different types of public assistance to provide that safety net. Um, and I think what's interesting, right, is these issues, affect many Nebraskans, not just women, but they do disproportionately impact women in certain ways. So again, why is that? And that's something where some of our quantitative findings come in. Basically, in general, with or without children, women in Nebraska are more likely than men to live at or near the poverty threshold. So the graphic on the screen here sort of depicts different thresholds there. So even more, right, while someone below the poverty threshold, it really sort of underestimates the true nature of financial hardship. In our full report, if for those who aren't as aware of the poverty threshold, we talk about what that actual income is for a family of four. So you can really wrap your mind around, right, sort of where that poverty threshold lies. However, nearly 1 in 3 women in Nebraska, or approximately 300,000 individuals, um, live at or below twice the poverty line. So that would be that dark blue, orange, and green bars. And as you can see, those bars are bigger for women than men. In addition to that, right, contrary to harmful narratives about poverty and work, many women experiencing more extreme forms of economic security are employed. So, women in Nebraska are about 12% more likely than men to be employed and have incomes at or below 200% of the poverty threshold. So, a lot of the folks represented in those dark blue, orange, and green parts of this bar chart, many of them are employed and working. In addition to that, women access public assistance at higher rates, yet they receive less support on average than men, is what our analysis found. So women comprise 3 in 5 of those accessing public assistance, such as supplemental security income. So what that means is that policy choices are made around these social programs, right? When those choices are made, they disproportionately impact women because more women are accessing those programs, as demonstrated by our quantitative analysis. So I think some of those policy choices around public assistance may feel more obvious to us, right? Maybe we've seen, especially for those of you involved with some of Women's Fund work at the state legislature, all of the conversations around setting income eligibility thresholds for certain programs, right? And if those income eligibility thresholds, like Title 20 for childcare, if they sunset and then go back to a certain level, that means fewer people are going to have access to that care if that, or that program rather, that threshold is put lower, right? There's those sorts of policy choices. However, I think one piece to think about that maybe isn't as obvious and that our qualitative research also illuminated is that administrative processes and procedures influence accessibility to public assistance programs. And it's really important, in addition to providing administrative processes that are clear, accessible, for people to even be aware that public assistance exists in the first place. And again, those are things that our research participants talked about. So a couple exemplar quotes for that. This particular individual was talking about a program called MOBI, which actually I didn't even know much about until this research project. It's through, I believe, the city of Omaha to access the bus system, especially for, according to the American Disabilities Act, basically having that complimentary service. But yeah, again, talking about the length of that application, everything you have to sort of all the hoops you jump through to access it. Although they do acknowledge, right? Like once I had access to this program, it was really great. In addition, this other participant talks about, how they didn't know, right, that they could have access to all of these different programs. So again, I think that ultimately shows that the complexity of some of these programs can leave people without resources they might qualify for. And again, these administrative burdens create another layer of inequity, right? So those who have fewer resources to navigate bureaucracy, how that might add additional challenges to access, the public assistance programs they need. You think about hours, for example, that many of these places are open, and if there's childcare obligations or things like that, how hard it might be to access some of these programs. So for our final finding for today, I think is a really important one to keep in mind. So basically, despite systemic barriers, many of which we described today, our research did find that women have demonstrated lots of resilience, resourcefulness. They've both benefited from and provided support to themselves and to our communities. So with that, we have one last poll. So what do you all think about what percentage of women in Nebraska do you think are self-employed? So go to our data definitions index in our appendix of the report for a full description of that. But that's generally, right, people who may own their own business or work for themselves. They're not necessarily employed by an organization. Looks like we have a variety of responses here. All right, what's our answer, everybody? Let's end it. All right, for those of you who guessed D, 31 to 40%, you are correct. So it's a higher number than maybe some folks anticipated. So yes, D, 31 to 40%. So if you did answer C, that 21 to 30% range, you would have been correct if you were guessing the rate as of 2016. So our analysis did find that self-employment among women in Nebraska has increased from 27% in 2016 to 32% in 2021. So interestingly, as you can see in this graph here, men's self-employment decreased over the same time period. So again, sort of wider on the left-hand side for 2016. One line goes down, that's the line for men. And then the line in purple goes up a little bit, again, for women's self-employment. So we can speculate that this, indicates women are perhaps adapting in creative ways to earn income that meets their needs. It might also, right, point out to how rigid or unsupportive workplaces might be pushing people to seek alternative paths to earn income. So our qualitative findings also shed some light on just entrepreneurial spirit in general. Participants shared how they turned to supplemental work, small businesses, side hustles, things like that, to supplement their income and increase their stability. Furthermore, some women pursued entrepreneurship not only to support themselves, but they found an emerging need in the community. So again, lots of different quotes that exemplified this in their research, but here's just a short sample. And a variety, right? People who did a landscaping company and then they even opened another business in addition to that. Someone baking cakes. Someone even doing some TikTok influencing, right? So I think what's important to think about here is that even with systems that limit opportunity, our participants shared lots of stories, right, of strength, creativity, persistence, navigating economic insecurity. But I do think it's important to remember is just because our neighbors, ourselves, just because we're resilient, it does not mean the system is working. However, it reflects how individuals adapt when the support they need is missing. All right, so that was a lot of information. We really wanted to try and at least give you all a good sampling of everything that's included in the report without too much overwhelm. So hopefully we hit the right balance. But like I already said, we have lots more in both the executive summary and the full report for Unequal Plains. So what's on this slide just sort of summarizes that again, right? There will be more stories and quotes. Especially I think adding that additional nuance and intersections, right? Like we have some stories from older Nebraskans who talk about continuing to financially support their children and grandchildren, or how immigration status influences access to job opportunities. Lots of rich data. In addition, even more statistics for those of you who want those. In addition to, general research, lots of citations if you want to do deeper dives into any particular topic area. Also, specific recommended actions. Joe is going to join us in just a second to overview some of those. And then again, if those of you, who really want to dive deep into data definitions and methodology, we have that fully detailed appendix for y'all. All right. With that, I think we're gonna pause. And again, this is sort of open Q&A. So I invite anybody, if you have a question that, we didn't address yet, please type it into the Q&A function. And yeah, we'll do a little bit of that.